Hello everyone, let's try to solve this question together. So here we have a CT chest which is obtained on a 6-week-old premature infant who remains on supplemental oxygen. Based on the CT findings, the best action is, pause the slide, zoom the picture. What do you guys think? Okay, the correct response here is obtain a swallow study. The reason is, if you guys can see like here, you see signs, and here also. So this one is a coronal view and this is the transverse view. So you guys can see there is some infiltrates there. Most likely is chronic aspiration. Babies who have this patient is most likely BPD. I don't have a gestational age here, but most likely it's a chronic lung disease, which that's why the CT scan was done, and infant is on supplemental oxygen. Just touching base again, so definition of BPD is now has changed. It has gone through a lot of revisions, but now easy to remember. Now it's in grade. Grade 0 is of course no oxygen. Grade 1 is less than 2 liter. Grade 2 is greater than 2 liter, and grade 3 when they have non-invasive ventilation need, CPAP or non-invasive NIPPV or ventilation. So anyway, this information was not given, but I just wanted to take the opportunity to talk about what is BPD. So bronchoscopy could be performed, but again, first thing first, let's try to solve why this patient is having this infiltrate here. If swallow study shows normal finding, then one can go ahead with the rigid bronchoscopy, which is an invasive procedure. And of course, for that, you need pulmonology consult and evaluation. Using a nebulization, this doesn't look like this is a local problem. It doesn't look like the whole lung is involved. So using normal saline with nebulization with the idea of diluting the secretion which can come out, this doesn't look like a secretion problem. So that's why nebulization is not the answer, correct choice here. Is starting systemic steroids is again an option. As you guys know that BPD is being treated with prednisolone for 6 weeks. Sometimes we use a taper dose, and again pulmonology will guide you on that. But again, this doesn't look like this is a very acute, like a regional problem. So again, like I said, all could be done, but obtaining swallow study should be the primary thing here. And just to show you in this screenshot that aspiration and related to the bronchopulmonary dysplasia, because of these other risk factors, because airways damage, there is swallowing dysfunction, and of course GE reflux. These all three add in making this baby at high risk for aspiration. And swallow studies many times are really very informative, and that can guide further, and you can work with your speech language pathology consultants to solve these issues. So I hope you guys have learned something together today. Please do like and subscribe to our channel, and you guys have a wonderful day. Bye.